Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. Tocolytics and uterotonics are medications that have an effect on the uterus. Tocolytics are medications that can decrease the contractility of the uterus or make the uterus relax. The main time that we would use tocolytics in pregnancy would be to slow down contractions if the patient's preterm, or maybe for non-reassuring fetal heart tracings during labor. Uterotonics are medications that make the uterus contract or make it squeeze. The main time we consider uterotonics in the immediate postpartum period would be right after delivery to help control bleeding. So looking first at tocolytics, these are our medications that relax the uterus. It's not my time is a way to remember these medications. The I is for Indocin. Indocin is a nonsteroidal anti-inflammatory drug. It's in the same family as ibuprofen. And we typically tell pregnant women not to take ibuprofen when they're pregnant because that these drugs can cause a premature closure of the ductus arteriosus. This is also true for Indocin, therefore we will not use it after 32 weeks gestation. The reason that we are concerned about the ductus arteriosus is that this is going to be the shunt in the fetal circulation that helps take that oxygenated blood and bypass the lungs and send it directly out to the baby's body. So we don't want to cause that to close too soon. Nifedipine is also called Procardia. This is a calcium channel blocker that's often used as a blood pressure medication because it works on the smooth muscle to relax the vasculature, and it also works on the smooth muscle of the uterus. If we're using nifedipine, we need to watch mom's blood pressure. Magnesium sulfate is a central nervous system depressant. This is often used for preeclampsia to help control seizures or minimize seizure risk. It has a tocolytic effect on the uterus, so it can be used for this purpose, and it has an added benefit that it can offer neuroprotection for a baby if they're going to be delivered preterm. However, there are a lot of considerations with magnesium sulfate related to toxicity. So all of the things that we consider with a patient who's preeclamptic on magnesium sulfate would still apply to this. So we would need to be monitoring the neurologic status, the vital signs, the respiratory rate, urine output, all of those things. And then the T is for terbutaline. Terbutaline is often used as our drug of choice if we're having a non-reassuring fetal heart tracing during labor. This is going to help slow contractions down to increase the perfusion to the placenta. Terbutaline's side effect is tachycardia, so it's also important to know what the vital signs are before administering this medication. Our uterotonics are our medications that make the uterus squeeze. Please Come Help Me is a way that we can remember these medications. The P is for Pitocin, also called Oxytocin. This medication is often given prophylactically when a patient delivers to help minimize the risk that she will bleed. So we don't necessarily wait until she's bleeding to use it. C is for Cytotec, also called Misoprostol. And this one is very versatile. It can be given orally, rectally, or it can also be put in the buccal space. H is for Hemabate, also called Carboprost. This medication is contraindicated with asthma, so you would not use it if your patient is asthmatic. M is for Methergine. Methergine is contraindicated with hypertension and preeclampsia. The thing is, if your patient's bleeding, she might not be hypertensive right now, but if she's been hypertensive in labor or if she is preeclamptic, we wouldn't give this medication. So to review our tocolytics and our uterotonics. Tocolytics are medications that decrease the contractility of the uterus. It's Not My Time is a way to remember these medications. The I is for Indocin. The N is for nifedipine. The M is for magnesium sulfate, and the T is for terbutaline. Uterotonics are medications that increase the contractility of the uterus or make it squeeze. Please Come Help Me is a way to remember these medications. The P is for Pitocin, the C is for Cytotec, the H is for Hemabate, and the M is for Methergine. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.